Hi, everyone, and welcome to MetaVivor's Engagement Conference Series, Overcoming Health Disparities in Metastatic Breast Cancer. MetaVivor is a nonprofit organization with a primary mission to fund critical research that will lead to advances in treatment options, improve quality of life, and survival for patients diagnosed with stage 4 metastatic breast cancer. Since our founding in 2009, we have awarded 135 research grants totaling over $18 million. MetaVivor is the only national organization with a peer-reviewed grant program aimed at exclusively funding MBC research. 100% of every donation we receive goes to fund metastatic breast cancer research. MetaVivor also raises awareness of MBC, provides support for people living with the terminal disease, and offers opportunities for others to help make a difference for the metastatic community. Please mute yourself until each speaker's Q&A time. If you need to ask a question during a presentation, please use the chat function. Also, please stay with us for our facilitated roundtable discussion, as this is a key part of our program. For those of you who have attended our engagement conferences in the past, a lot of really important priorities emerge from this discussion. Our goal is to finish the 2-day conference with actionable steps to work toward overcoming disparities in metastatic breast cancer, whether that is in the healthcare setting, in research, or driven by our fabulous patient advocates. Thank you to our sponsors, AstraZeneca, Eisai, Lilly, and Pfizer, and our partners at ASCO, Tiger Lily, and the Chrysalis Initiative for their participation. Our title sponsor is AstraZeneca, and I would like to introduce Dr. Josefa Briceno of AstraZeneca to say a few words.
Thank you so much, Jamil. Good evening. So, as she said, my name is Josefa Briceno. I'm the U.S. breast cancer medical head at AstraZeneca, and it's a true honor to be here with you to support the MBC Health Disparities Conference hosted by our partner, METAvivor. I'm really delighted to be here today, super excited to discuss this super important topic with all of you and come together to identify ways in which we can build trust and equal representation of all our patients in healthcare and in clinical trials. We at AstraZeneca have been committed to patients with advanced breast cancer for more than 40 years, and we continue to investigate therapies that will provide better options for those living with this disease. With metastatic breast cancer, currently there is no cure, and the goal of treatment is to delay disease progression with good quality of life. So each month, each year that patients do not experience disease progression translates into precious moments with friends and family, from the birth of a grandchild to attending a high school or college graduation, time with grandchildren, many special moments. And by us championing the development of innovative therapies, we as AstraZeneca are pursuing our bold ambition to redefine cancer treatments and one day eliminate cancer as a cause of death. Alongside the community, we're working to ensure equal access to our medicines, diversity in our clinical trials, and equitable health outcomes across patient populations and racial minorities. We are working to build an inclusive culture, leveraging the strength and diversity of our people, particularly underrepresented populations like ethnic minorities, women in leadership, early talent. We really know that a diverse workforce and an inclusive environment fosters a culture of trust where engaged employees can safely generate, debate new ideas, and ultimately cultivating the significant innovation that leads to new treatment options for patients. Well, we know that there's a tremendous amount still to be done in the journey of health equity. We are very proud of the partnerships we've created across the healthcare ecosystem as we work together towards a more unbiased and equitable society. While we have the bold ambition of eliminating cancer as a cause of death, we really recognize that we cannot do this alone. Everyone here today and the entire oncology community is already doing so much to collectively make a difference for patients and their loved ones. And how not to speak about the COVID pandemic. The COVID pandemic laid bare certain inequities in healthcare and elevated our ethical imperative to better serve our communities. So our focus in closing the gaps in health outcomes centers on four things. First, enhancing the collaborations with the community and professional organizations patients turn to the most. Second, creating programs alongside the community to enhance equal access to care. Third, develop culturally relevant resources across the cancer types we serve. And fourth, ensuring all patients are represented by building more diverse and inclusive clinical trials, working hard to remove those barriers to trial participation for those from underrepresented populations. And I wanted to mention a leading example of serving our communities is that's AstraZeneca's 5-year commitment to Accelerate Change Together, or ACT, on health equity, which established a Health Equity Advisory Council comprised of leaders from the public and private sector who will contribute to a long-term roadmap for AstraZeneca in the US. So within each area of our oncology business, we're partnering with and supporting advocacy group initiatives to deliver on our health equity promise. So to close, we really know that we're just one piece of the puzzle in bringing this big vision to reality. It will take all of us, the entire community, to come together to ensure equitable care. It is really, truly my pleasure to be working alongside each of you as we collectively work to overcome these disparities for those living with advanced breast cancer. And I truly look forward to learning more from you and hearing your perspective on addressing these needs to ensure that all patients can access the care they need for the best possible outcomes. Thank you so very much.
Thank you, Dr. Briceno. So why are we here today? The overall rate of breast cancer is similar for Black and white women, although Black women are 42% more likely to die from the disease. Other disparities for Black women compared with white women include a higher rate of breast cancer before age 40, a greater likelihood of being diagnosed at a late stage, and an increased risk of having triple-negative breast cancer, which tends to be more aggressive. Because METAvivor was founded on the principles of transparency, integrity, and fairness, it is important for us to prioritize equity and equality. Over the years, we have heard many stories about treatment options not being made available to certain patients, possibly based on race, location, and other social economic factors. Now there is more evidence that there can be bias in the healthcare space. It is important to look at the bigger picture and understand how research can move forward as well. Over the years, METAvivor has made specific strides in overcoming disparities by targeting specific communities for advocacy and visiting rural areas and people of color, specifically Black communities, and targeting the patient population to advocate for themselves. But patients cannot do this alone. METAvivor convened a committee to look at these issues and decided that our best approach would be to have experts discuss these issues, enlighten us on the current disparities, and then work with us to develop actionable strategies to overcome these disparities. Our committee is made up of many living with MBC, as well as caregivers, and some who have unfortunately passed during the planning of the conference. A big thank you goes to Shante Drakeford, Stephanie Walker, Kelly Shanahan, Barry Link, CJ Corneliuson, Shield McGlown, Carlitha Spirit Cephas, and who has passed, and Shantae Randall, who has also passed.